meals annually.
Louder. Speak into the mic.
At the same time, New York is an agriculturally rich state with 35,000 farms producing $3.5 billion worth of products each year. Increasing the amount of local food in New York's public plate meals represents a true win-win that can not only improve public health, but also preserve farms and farmland, create jobs, keep food dollars local, and increase our regional resiliency and sustainability. I'd like to thank our panelists for being here this morning. They are some of the leading lights working to understand and improve our food systems and create wellness for all New Yorkers. Sarah Barton is the Director of Program Development at the New York State Department of Agriculture and Markets. She works in the Brooklyn office overseeing a portfolio of economic and development initiatives. Among the biggest of these is work to grow institutional procurement of New York State agricultural products. Barbara Turk has served as the city's Director of Food Policy since 2014. Reading the city's annual food metrics report is a good introduction to the immense scope of the city's food work and Barbara's involvement in dozens of programs, large and small, across city government to ensure that all New Yorkers have equitable access to nutritious, affordable, and sustainable food. Kristie Lancaster is Associate Professor and Director of the Graduate Nutrition Program at NYU Steinhardt and a registered dietitian. Kristie's work focuses on cultural, psychosocial, and environmental influences on dietary behaviors that affect hypertension, cardiovascular disease, diabetes, and obesity in vulnerable communities, especially African Americans. Kristie also works with faith-based and other community organizations to promote health in Harlem. Greg Silverman is Executive Director at Westside Campaign Against Hunger. Each year, WISCA distributes 1.7 million pounds of healthy food to more than 20,000 individuals through their supermarket-style food pantry. They also provide social services and case management, health and wellness programming, advocacy for increased resources for food programs, and a chef training program. Lynn Loflin is the Teaching Kitchen Executive Chef here at Lenox Hill Neighborhood House. Previously, she was our executive chef and led the transformation of our food services to a farm-to-institution model, serving 390,000 fresh, healthy, and locally sourced meals annually. Through her current role, Lynn works with 50 nonprofits program sites annually, providing a full year of training and technical assistance to help them convert to a farm-to-institution model to serve more fresh, healthy, and local food to low-income New Yorkers. I'd like to start off by talking a little bit about creating wellness. Kristie, what kind of wellness can we achieve by making public plate meals healthier and more local, and how can nutrition education complement healthier meals to affect behavioral change?
In 3 words. Right. It's on?
Yes.
Okay, great. Well, I think one of the things that is great to me about being a dietitian is the fact that some of our biggest health problems, as you said, hypertension, cardiovascular disease, diabetes, obesity, some cancers can be influenced by having a healthy diet. And there's lots of different ideas these days about what that means to have a healthy diet. But some of the things that don't change, 2 of the biggest things that don't change are eating more fruits and vegetables across everything. And even in terms of sustainability, more fruits and vegetables, less red meat, less animal foods, fewer animal foods. And I think that certainly that is not the way our diet looks right now. Very few, a small percentage of people in the U.S. eat the recommended amount of fruits and vegetables every day. And I think having public plate meals that have more fruits and vegetables and more whole grains, adding more fiber, more nutrients, just by making those 2 changes can have a big effect. However, nutrition education is important because people aren't used to eating a lot of fruits and vegetables. and they see these things potentially on the, in front of them on the tray line or on their plate, and may not be as likely to eat them, or if they have a choice, they may not choose them. And so helping people to understand why it's good to eat fruits and vegetables, but also giving them the opportunity to taste things and see that they actually, healthy food can taste good is key. With that said, even though nutrition education is important, just knowing what to eat does not mean that people are going to actually do it. So that's the next step. The challenge is actually changing behavior, and I don't think we've figured that one out yet, but I think more exposure can make a difference.
Greg and Lynn, part of working to serve more local and fresh food is, as you pointed out, Greg, asking a lot of people to do more cooking, including the people that you serve through your food pantries and staff at nonprofit organizations trying to serve through a farm-to-institution model. Can you both talk about how you work with that challenge of asking people to do more work?
I'll try to phrase it differently. My background is as a chef and restaurant owner, so I'm all about getting more people cooking because I think it's not simply just more work, but it's a joy. We definitely believe at the Westside Campaign Against Hunger, 42% of the food we distribute is fresh fruits and vegetables. Most of the animal protein we give out is in whole form. Our customers are mostly immigrant families. They don't want chicken nuggets and chicken tenders. They want actually quarters, halves, and whole chickens, and they cook. So I mean, in one sense, it's a question of who are we asking to do more work, because the last bastion of hope for people cooking in America is probably poor immigrant families. Everyone else is cooking for sport, right? Like we have this sort of Instagram foodie world. Like if you look hashtag foodie, you're gonna see like there's something like, I forgot the 100 million people who have hashtag that. I mean, it's absolute silliness, right? When you hashtag angry, you don't hear about people on Snap, you hear about people wanting their latte. And I think this sort of feeds into an issue. I think the positive is we're giving people, I'd say the flip side, an opportunity to use their time to cook and engage with their families in a way that most people across the planet are refusing to do these days. So it's difficult, but we find from our surveys with our customers, they actually want whole ingredients. They want to be able to provide wholesome meals for their family. And yes, it takes time.
Good morning. Here at Lenox Hill Neighborhood House, as we transitioned our food service programs for the last 7 years, we were moving towards more plant-based meals, more fresh vegetables, more diverse grains, and trying to source it locally. Our clients actually were not asking for this. They were asking, in the main, for more pot roast and mashed potatoes. So I think that the biggest challenge for us in the part of the puzzle that we fit into, which is serving 390,000 institutional meals a year to essentially low-income New Yorkers, is similar to what you're saying and similar to what Kristie's saying. Our biggest challenge is to change people's perception of what a good plate of food looks like. And our most successful strategies to do this were really making the changes. We made these changes from 90% canned and frozen vegetables to 90% fresh, from 1 or 2 grains and pasta and bread to 7 grains, whole grains. We made these changes mainly over 5 years. So we made the changes incrementally and gave not only our clients time to adjust and our staff time to pick up the skills that they needed to actually cook this food and do a different style of cooking, which is what you're talking about. But it also, whenever we had a misstep, it was because, like in the first 6 months, I radically shrunk the meat portions. And it was too fast, too soon, and we got way too much revolt. And the other successful, I think, strategy that we used was not just nutritional and culinary education, but also an enormous amount of engagement on all levels with our clients, with all our clients, from the seniors to the women at our homeless shelter to the 3 to 5 year olds to the parents of the 3 to 5 year olds. We talked to them about what we were doing. We gave them nutritional and culinary education. We listened, particularly in the seniors' case, we listened to the complaints. We actually tweaked things that we could. So I think part of engagement, which is a very ubiquitous word in the nonprofit world, we actually listened, which I think needs to be a big part of engagement. And I will say we did proceed on with what we were doing, and we made it to 90% fresh vegetables. We are also currently at 55% plant-based meals, and we serve, and the interesting thing about that is we actually, in our programs like our senior centers, we have more people attending for meals at this point. So I'm sure there are many reasons for that, but it can't just be that they obviously like the meals too. Another factor is, like Greg said, you have to make the food taste good.
Sarah and Barbara, there's also a lot of comment on the fact that policy change can accomplish more faster than work at the consumer end. And I know both the state and city have worked to incentivize local purchasing in recent years. Could you both talk a little bit about how policy is affecting institutional food purchasing, where we are now, and what your goals are for the future?
Sure. So, is that on?
Yep.
Okay. So, I'd say the first thing is, both of us represent the city and the state, but there's also the federal context, and that's sort of a reality that we all have to operate within, and all of the institutions that we work to serve as the state, a lot of them have to reconcile with federal elements of policy as well, so they have to comply with standards that are set by the feds, and that has been an interesting challenge to navigate from a nutrition standpoint when you look at schools, from a compliance with federal spending standpoint when you look at procurement, and all of that serves as sort of a backdrop to setting good standards for procuring fresh, local, healthy food. From the Department of Agriculture standpoint, we work to serve both the producers and the consumers, or the purchasers of food, whether they are direct consumers or whether they are institutions that are purchasing. The state has set in the last 5 years a set of standards through something called the Food Metrics Bill, which I think was passed in 2013 and was developed sort of implementation guidelines, which allows for our state agencies to set sort of optional levels of local preference, which allow them to pull through local, fresh, healthy food if they want to. And that's been a boon for some of them, but working to actually make that possible within the limitations of price is really, really difficult. And then the local jurisdictions have the opportunity to set their own parameters, and that's actually been a really interesting thing to watch how that's worked from the perspective of both helping producers, but also really setting, I would say personally, some of the sort of the leading guidelines of how we can do the best possible, set the best possible guidelines from a nutrition standpoint and also from a purchasing standpoint that can best support both like dignity and equity and choice for consumers, while also being responsible stewards of taxpayer dollars. And I would say that Barbara and her team have been really incredible leaders on that front.
Sarah, and thank you everyone. This is such a great panel. Wonderful with all these heroes. Barbara just walked in. Barbara is somebody you all should know too. project renewal. She is aiding, how many sites? 31 sites. Project renewal, they have a program that trains people who are in their programs who are, homeless, were homeless. So I just want to, and they are part of a catering service. So, and they abide by our city food purchasing guidelines. Segue. So the city has had, okay, is that better? Yeah, you got to be right
Get to the mics a little bit.
right here. Okay. The city has had food standards now since 2008. So happy anniversary of the first decade of food standards. So that means we've actually learned a lot. The food standards cover two areas as it stands. One is nutrition guidelines and requirements. And the other is sustainability. And I think, as Sarah was saying, there are absolutely, we always have to say that there are restrictions on this. So for example, if I decide I want to go to the supermarket and just have a this week it's planetary healthy diet, which is sustainable and nutritious, benefits local workers, whatever it is I'm working on, right, in my diet. My diet is, I was inspired by Francis Moore LePay and my college years, so that's where I'm coming from. The more things change, the more they stay the same. And I would say that I can do that without, as long as I have the budget to do it, personally, which I do, and that's a very important distinction that we need to keep carrying out in this panel. But for somebody like me who has choices, I can go in and I can buy that, I can buy a diet that, is good for the planet, good for my body. With public procurement, it's not that simple to turn that on a dime for the $300 million that we spend on food, but we're working on it. And one of the reasons we work on this is because I think what's very clear at this point is that our purchasing power can change the market. And we should talk about that because what Sarah and I are working on has to do with changing the market, bringing all of this to scale. And that is actually urgent at this point from both the chronic diet-related disease perspective, but also in terms of climate and sustainability. So we do have some real restrictions, starting with the state constitution, which Sarah is not responsible for. I want to make that very clear. There's the state. Had we had a state constitutional convention, Sarah and I would have been the first people to say that we need to change this provision that says we can't use procurement to do social good, essentially. It means that we can't favor certain kinds of businesses, maybe minority and women-owned businesses, right? We can, however, do some things with some of our bids in terms of the language, and that's where we work, is on that, to preference certain things. And when you start to say, well, we want this kind of apple, and those are apples that are only grown in New York State, that's a good thing. So that's a little bit about, a little intro to procurement. I want to say that procurement is endlessly fascinating.
It actually is.
And it is. And so I'm really delighted to be in a conversation that frames it in this way. And the public spend is going to change the world ultimately. It already has. We have antibiotic-free chicken now in all of our schools. It was a 5-year process. And there's more that we can do at scale that will also help our New York State farmers, our New York City manufacturers, distributors, and food workers.
And just one quick addition on the scale piece is New York City, I believe, is outside of the United States military, the largest institutional procurer in the world. So it's huge, and when she says we change the market, that's why.
Barbara, just a quick question. The last time you were here, you and I discussed briefly the Good Food procurement program. Is that?
Yes, thank you for the I wasn't sure if this was the time. But it's, yes, it is the time. So, good food purchasing. How many of you know, when I say good food purchasing, capital GF, capital F, capital P, how many of you know what I'm talking about? All right, so let me just give you a brief discussion of this. Generically, this is value-based procurement. So the idea here is that when I say that we value sustainable and nutrition in our sourcing, wherever we can. My colleagues in Los Angeles who work for Mayor Villaraigosa, who are now, did this thing in Los Angeles in the Unified School District, and some of you are familiar with this, where they said, we would like to have a policy that advances 5 values, not only nutrition and sustainability, but also local sourcing, fair food, meaning food that is purchased from companies that are fair to their employees, and abiding by all the labor standards of their location, and the other is animal welfare. And so those are the 5 values, and they developed kind of a system for evaluating. This is not a requirement of the LAUSD, but it's a system for evaluating sort of where you are, a set of indicators that you can keep getting better and better and better at, more and more local, more. And so it's kind of a star system. It's kind of, some people would say, a lead certification system. Some people get nuts at City Hall when I say that. So just it's a way to see your progress, and people are naturally competitive, so it works pretty well. And I would say that, so we've started working, the people who worked on that in LA are now the Center for Good Food Purchasing, and they're looking to work with institutions large and small, but mostly, let's say at this point it's large, and mostly governments, although some are hospitals, to change what they're buying so that there's more, it advances all those values. I personally love this because it brings, procurement is the thing that we really have the most leverage over. As much as we would like to say we have leverage over a lot of different things as local governments, we really have, procurement is the place to make change in the food system. And so we have an opportunity here we are now in the process of working with the center to do baseline evaluations of not just our school system, but of all of our city agencies that do food purchasing. At this point, that does not include the city purchasing that the city funds that are spent by entities like Lynn. But, that can happen, that will happen. It's premature, we should talk about that. But in terms of money we've been able to raise to hire the center, we're going to go through everybody that contracts through, whether it's ACS and their juvenile justice programs, the Department of Correction and their detention program, school kids, homeless shelters that the city runs. It's going to run the gamut. And so we're in the process of doing this. We've done some baseline work. We've done some action planning. Being a little vague here, I get that, but this is a process. I have an existing group that has been an internal work group now for the last 10 years because we've been working on nutrition standards and rollouts and maybe so that same group has an appetite. We're like 95% compliant with the nutrition standards. That same group has an appetite, as we say in food, to do more. And it's been really exciting how much empowerment that people feel like they have if they say, hey, we could actually dictate, but that we could actually ask for more from the people that we're buying from. And first thing we need to ask for is more transparency. So I could talk about this for a long time, but it's a short panel, but I just want to introduce this because it is the way that we're going to use our procurement clout, and we'll work with the law department, but we can't do everything, but we can do a whole lot to do things like reduce the amount of meat we buy, and we can do everything that Lynn is doing at a larger scale because Lynn's leading the charge here.
So I'd ask, because with the Teaching Kitchen, we look a lot at the consumer end. So I'd like to ask Sarah, but also Greg and Lynn to weigh in about some of the barriers to, if we implement a 25% local quota, what are the barriers that we're going to run up against? both in feeding people and in working with agriculture.
Do you guys want to go first?
Sure. Yeah. I think I can mainly speak to the fact that over between 2011 and 2015, we went from probably 0 to 5% regional food to 40% regional food. Now that was largely, thank you, that was largely due to the fact that Green Market Co. came into existence about the same time we were doing this work. And if you don't know, Green Market Co. is the wholesale distribution arm of the Grow NYC agency. So that made it possible in the first 6 months that I had the job for us to start ordering local products. Otherwise, we would have not been able to do this because no matter what our will was organizationally, we were not going to go to farms to get the food. So I think the most important thing I can say about our approach from our procurement is that, to be very concrete about it, as Barbara pointed out, the DOE does what they do because of their scale. We are actually positioned, and organizations like us and many of the organizations that we train are positioned in scale, in an efficiency and an economy of scale to be the perfect market for this. And that's why we were able to do it. We serve 8,000 or 9,000 meals a week. That's about 1,350 meals a day. Realistically, it is very easy for us to get in 40-pound bags of oats. We go through 2 or 3 a month. We use 150 pounds of New York State polenta a month. This was not difficult for us even before we renovated our kitchens because we were buying 25-pound bags of Uncle Ben's parboiled rice anyway. And so we could use those.
You also have a kitchen.
We have a kitchen.
Which is great.
We have 2 kitchens actually, and one of our kitchens 3 years ago was renovated to be a really state-of-the-art kitchen. So now we have no excuses. But the point being that a lot of the places that we train are not able to procure a 40-pound bag of oats because if they're serving 50 3 to 5-year-olds 5 days a week, breakfast, lunch, and a snack, it'll take them 2 months to use that up, and it's just not efficient. So there will need to be further down the line for them different ways to distribute and get that to them. Maybe smaller food hubs. I mean, we train organizations that have 13 different sites. Maybe they can aggregate that. The other thing is for people like us, I mean, scale is just really important. We use 8,000 or 9,000 pieces of hand fruit a week. So it was a no-brainer for us to immediately, in the first 6 months of starting this transformation, to start using 16 to 25 cases of New York State apples because Green Market Co. could deliver them, and we were buying 9,000 pieces of fruit anyway. And our 800 to 1,000 bushels of apples a year actually moves that needle in upstate New York. We help support a farm or two. We don't support them, but we help support them. And other organizations like us, like Barbara's Project Renewal, using local fruit, she serves 2,000 or 3,000 meals a day. If they're buying some local apples, they can really move the needle.
I guess on barriers, you know, we kind of, at WISCA, we give out about 1.7 million pounds of food a year to our grocery store. About 70% is in kind, so 30% is purchase. So there's, right, we have in-kind barriers and we have purchase barriers. I think in the in-kind side, and we are getting products sometimes that we don't want, right? And when we start thinking about where food comes from, we refuse that food, right? We send back inferior food to the network to say we actually refuse, in the name of our 22,000 customers, to distribute high sodium, high fat, high sugar products, sugar-laden beverages. And most of the people that we talk to, other food pantries, They can't do that, right? They don't have the 24 staff I have, the 800 volunteers, and the voice, and the use of social media to sort of do that and push back. So we somewhat do that in the name of those other groups. At the same time, on the purchase side, we all work in these little silos, right? There's 900 emergency food providers just in my little sector alone in New York City dealing with an emergency. And emergencies don't last 40 years, right? Like, emergency food providers are mostly been around 40 years. That's the longest emergency I've ever heard of. It's an absurdity. And they've all been working really hard with their heads down. It's like really, as a chef, it's like chopping onions all day long without realizing someone's already filled the walk-in with like all the prep you need. It's absolutely ludicrous. And so one of the things we started to realize is we pulled together a collective purchase model we're piloting with a few of our other largest pantries in the city to start to see like how many pounds of onions do we purchase a year? How many pounds of chicken are we purchasing? What about milk? We realized right away that we're spending 10 cents more per quart of milk, which adds up to I think $13,000 we should be saving just off the top of the first quick thing. But this idea, to me, right, and I've said this many times to many people, it's how we work together in purchasing, partly because I actually have some bigger fish to fry, well not to fry, maybe to grill, but, and I look at some of the city and state contracts and I say, some of the food we're getting or being asked to receive is not what we want. Like I don't want bags of beef stew with 35% sodium, right, and high sugar. And that might be the only thing that some small pantries, when they're accessing their HIPMAP or EFAP, that they can draw down. We might leave money on the table, and that's ludicrous. But if you have sort of good food purchasing and these different models to sort of set benchmarks, higher up the food chain, through the food banking network and through the grant systems, we won't even have a choice of bad product, and we'll just have a choice of healthy product. And that makes life a lot easier all the way down the line to our customers.
And I would say that from our perspective, first of all, we as it stands can't set a 25% requirement because of some of the challenges that Barbara mentioned around the many intricacies of state law. But we can encourage, and we do encourage our state agencies to try and set either benchmarks or thresholds that they are meeting to be purchasing more fresh local food and to express local preference in their specific bids. And we're seeing them do that, and they are increasing their spend on local food, which is great. We're also doing some technical assistance training to those institutions through quarterly procurement calls to try and encourage them to leverage one another's contracts. And actually just in the last couple of weeks, by working with some of Greg's colleagues, we've learned that the nonprofits in the state can actually leverage the state's centralized contracts. They can use them, and they're low-cost contracts, but they do indicate what is local product, which allows at least for any institution in the state that's an eligible purchaser to say, okay, I want to buy, let's say it's, to use a specific example, Chobani yogurt, they might be able to say, we're currently buying X amount of Chobani yogurt at Y price. They might be able to find a really significant cost savings, which frees up more of their own budget to purchase truly fresh, truly local, fresh produce for their consumers. And I think that that's really important. I would say that from a challenges standpoint, beyond just our inability to set those kinds of benchmarks, a lot of what Lynn was saying about economies of scale really resonated. We have a number of sort of concomitant challenges here, and a lot of it has to do with supply chain stuff. So we have a lot of small and medium-sized producers in the state, and they can't independently meet the demands of large institutions, so aggregation is really important, and all the downstream elements of supply chain are equally important. So it's transportation, it's distribution, it's all supply chain logistics, which sounds really boring, but gets to be the key to making all of this institutional procurement work, and there's a lot of problems in New York. We worked with the city, who have been an excellent partner to try and bring in, with Olivia and Green Market Co. to establish the Bronx Wholesale Food, the Wholesale Farmers Market, which is going to open very soon. And we are in the process of conducting a feasibility study on a Brooklyn food hub to try and create some sort of equitable models of creating local aggregation in the downstate market, which is the largest food market in at least New York State and one of the largest in the world. That's one piece of it, but there's a lot of pieces of it that are really important. And as Lynn was mentioning, there's elements of this that need to be looked at. And Barbara and her team have done really great work at looking at what these problems are around how do we get the smaller producers into the supply chain and then keep them in the supply chain. And some of that has to do with creating institutional capacity for small purchasers to also be able to access things like kitchen space or freezer space, while also being able to leverage the lower prices available either through a large contract or through a collective purchasing opportunity.
Barbara, you mentioned the planetary health diet. I'm sure a lot of people here have read the Lancet Commission report. And many people here have read either the report or articles about the planetary health diet. All right, that's a few. It's for those who have not read it. It was an international commission of 37 scientists and experts that came together to form proposals for a diet that would both feed 10 billion people by 2050 and also addressed the planetary environmental impacts of our food systems. It's a very sobering report, a very ambitious vision for the steps that need to be taken for us to feed so many people without increasing global warming. Kristie, a lot of the reaction I've seen to the report has been about what actually eating the planetary health diet would look like and how hard it will be to get people to give up meat, to switch to more plant-based diet. What are your takeaways? What do you think the challenges are? Even if we build the machinery to save our food systems, can we achieve the change at the consumer end to make it possible?
I believe that we can achieve it, but I don't think that it's going to be easy. The idea of plant-based, I think it's this change to say plant-based as opposed to vegetarian is a positive thing. Maybe people will respond to that better. But I think we are socialized in this country to think that a plate is supposed to have mostly meat on it. I mean, like the largest portion of your plate would be meat, poultry, that sort of thing. And changing people's ideas about that, I think, is going to take some time. Like I said, most people do not eat enough fruits and vegetables, and I think changing people's ideas about that is going to also take some time and showing people that they can be full and satisfied and enjoy their meal without having as much meat on it. Lynn and I were talking earlier, and it's true that before maybe the last 50 years, there wasn't as much meat on the plate. Maybe in terms because of affordability and that sort of thing. And we see globally as people have higher incomes, part of the idea of being more prosperous is to eat more meat. And so there are social norms that are going to need to change. We are talking here about increasing fresh produce in public plate meals, and that's great, but there are issues of, first of all, accessibility in your neighborhood, which is improving in some ways. You've got the carts, green carts in different neighborhoods, and other ways in which accessibility has improved, but you have to use it. And how many people buy it and they don't get to it in time and it goes bad? And so while fresh is the most desirable thing, I think we also have to communicate to people that frozen can still be healthy and have the nutrients that we need. I think we need to think about what is practical for people. And even if you do, let's say, they're apples and they look really great, but you choose one, you bite into it, and it's mealy. Whereas the Snickers bar, you know exactly what that's going to taste like every single time. And so I think there are a variety of challenges that we need to understand that people have, not to mention the cost of fresh produce. And we need to address all of those things and help people understand that they can eat in a sustainable and healthy way on their budget.
I just want to add, it's related to this idea of, in some sense, the big urbanization question, right? And I go back to, I use this example just from my own personal past of being a Peace Corps volunteer in Mali, in a rural village in West Africa, where we ate millet and peanut butter sauce every day. And there was a little bit of meat that we all shared. And my friends from Mali, who some of them came and worked with me in my restaurants in New York, that I owned, all they wanted, these young guys, was hamburgers and chicken and meat, and it was accessible. Right? They could have, whereas back in there, and they loved the food, they loved having chicken every day. I did as well, but without refrigeration, like these things have happened in urbanization, right? You have access in a cheap way to products that we didn't have access to before, and also to put a pin on the idea that urbanization is also related to the developed world, right? Like the people who need to change their eating habits more are not the people most likely in rural South Asia, but in here in New York City, right? And this is the crux of the economic problem.
Yeah, so I do want to make this point too. So this latest commission report, I was talking to one of the commissioners who I work with regularly because she has led the London Food Policy Council and is very active in the University of London and has a food policy series and does a lot of work on obesity worldwide, tracking this trend that we're talking about. And there's a lot of messages depending on diets that people are championing. There was a lot of, sort of response from plant-forward, plant-based, vegan, keto. There was people who have those kinds of, what I refer to as those kinds of choices. What Corinna was saying, which is what I've been trying to continue to amplify, is that if you look at this report, the North American meat consumption, because it's regionalized, North American meat consumption is well beyond red meat consumption, all meat consumption, well beyond. And she said, the point of this whole thing is that people who are wealthier, and that includes all of us in this room relative to a story, relative to the planetary story, who have choices, are the people who have to change their diets to make any headway on this. And I would say that the thing I was about to say just went out of my head, but I think the other aspect of this is that beware of turning this all into a sort of, what is this going to look like, and what's the next Instagrammable menu based on this planetary diet idea. It really, Walter, who's the co-author of this and very well known Harvard Kennedy School, Harvard School of Health. Harvard School of Health. I never got to the coffee back then. But everything else was delicious. Thank you. But I wanted to say that his whole point is when you get him aside again is sort of like this is something that we really all have to think about as as those of us who are really, have made those choices and made that the sort of luxury diet that it is, and the, you know, the luxury car diets that it is. And I remember being a kid too, and like at a certain point, like we just didn't have any red meat on the table, and it really was about, like gas prices were going up in the 70s and it was just too expensive. You know, we weren't eating a lot of it, but we ate a lot of chicken after that. So, you know, I do think that we don't need to eat the way we do. And people who eat a lot of meat, who eat meat, tend to eat a lot of it. And again, I can only speak for my sort of strata, socioeconomic strata, racial strata of this conversation, but I think it's up to those of us who, you know, do spend a lot of money on food to think about that. And it's up to us to think about not just the public plate in this regard. And that's what I'm most concerned about, is that if we're going to do something on the public plate, we should be doing much more with restaurants, you know, portion sizes, and, you know, much more of a public kind of campaign around this.
I mean, talking about making large-scale changes to our institutional food systems at the same time, we need to incorporate input from the people that we are feeding. How do we best create a food system that's shaped by and strengthened by the communities it serves? Sarah, I know when we spoke on the phone, you were talking about your work in Brooklyn. I wonder if you could amplify that a little.
Yeah, and I actually think that this is something that everyone at this table probably has a lot more experience and expertise in than we do, but I think that one thing that has been really interesting and important for our office in Brooklyn has been, over the last year, working as part of a cross-agency initiative that's a sort of a health and wellness initiative led by the governor called Vital Brooklyn. We've started to do a lot more, our agency and our office has started to do a lot more direct community engagement, and through the process of the feasibility study that I mentioned earlier on our exploration of a Brooklyn food hub, we've started to really try and do more sort of concentrated outreach with community groups, organizations, and directly with members of the community. Something I wanted to mention was, both with respect to what we're, as sort of stewards of the institutional plate, what we're trying to sort of structure, and in terms of things like food benefit administration, which my agency doesn't oversee, but which we facilitate, SNAP, WIC, or supplemental benefits, health bucks, things like that. It's our job to make sure that all consumers, no matter health bucks, our version of health bucks is Fresh Connect. Yeah, so all of the, the city's checks are called health bucks, right? And then there's Double Up. There's all the sort of different jurisdictions. But there's, with all of the different benefits that are available, it's our job to make sure that we're responsibly ensuring that people also have choice, and that we're not dictating their choice or limiting their equity, I guess, and we're not limiting the sort of dignity of choice, that we're engaging them in the process, and that we are also, we're sort of using our collective purchasing capacity responsibly, but that we're also trying to bring them into the process of determining what they want for themselves. And that's not always simple, and it's not always straightforward, and it's also not always the same thing. There's a lot of conflict sometimes in those things. I'll give one other example on the plant-based diet piece, which I think is actually kind of interesting. We also have to think about, or we do think about in our agency, what's happening with producers a lot. And this has been a very tough year for the agricultural industry. We've seen declining demand for fluid milk and for dairy for 20 years, for example. There's been a lot more interest in plant-based dairy alternatives. That's interesting. So that's an opportunity potentially, but there's also a downside for producers. And it's our job to think about how do we manage that transition so that our producers are not disadvantaged in a way that then pushes them into the same exact sort of cycle of people that we're trying to help through making access to fresh, healthy, equitable food a possibility. So community input, I think, it's the responsibility of all government institutions, and seeking that feedback is really important.
Kristie, did you would you like to address? Does your research provide a tool for helping us shape a more equitable food system? Can it?
No. My research has been more so with people in the community, trying to help them understand how they can eat healthier, make healthier choices, and not as much about, like I said, we haven't figured out how to change behavior yet. So I'm not sure I have insight about that. Although I do find that when people have the opportunity to taste things, that they, when they like them, then they do sometimes add those to their diets. I did want to say, in terms of changing our plate just in general, not just institutional, and reducing the amount of meat on it. Who in here, you've probably seen the My Plate from the government, and that is half fruits and vegetables. And even in my introductory nutrition course, where people are there because they want to learn how to eat healthier, and I asked them how many people in here eat like that, where you've got half the plate is fruits, vegetables and or fruit, and then the other 2/4 are the starch and the meat. And very few of them raise their hands. So I'm just saying that to illustrate that it's something that is not, that people don't think about that immediately. And I love some of the materials that have come out from the Department of Health and Mental Hygiene here in New York City. But I think getting that message out is a really challenging thing. And just think about all of the billions of dollars in marketing for the unhealthy choices, soda, snacks, salty, high salt, high sugar things, and the tiny fraction of money that is put into marketing healthy foods. I think we need a real change in across the board, in the a community change, a social norm change, and I'm not quite sure how we make that happen. I mean, I think it takes an effort across everything, institutions, community organizations, schools and things, and then there are things that are happening in each one of those spaces, but I think it's a big job, but I feel like we can do it. It's going to take some time.
I just want to speak a little bit to that, because part of what the Teaching Kitchen does is to train these other organizations. We do this work here at Lenox Hill Neighborhood House, and then we also have trained 80+ organizations over the past 2 or 3 years, in New York City, cooking about 5.5 million meals a year. And some students are better than other students, but a lot of the work that we do is just bringing up the whole subject of the regional food shed. And I can tell you that most of the cooks in community-based organizations in New York City, no matter who they're cooking for, are not sitting around thinking about their regional food shed. They're also not aware of what New York State grows and when it grows it. They're not aware of what New York State storage vegetables, or forget New York State actually, but just the region. Our cohort last week, we had brought out kohlrabi, celeriac, celery root, we had turnips, we had winter storage radishes, we had all these vegetables, and one out of 14 people had ever seen this before. Nobody, and that one person had tasted it too, so we all tasted it and everybody was like, oh, this is delicious. And then we made slaw out of it. We served slaw here yesterday at Lenox Hill Neighborhood House with cabbage, kohlrabi, celeriac, and winter radish, all in the slaw. And I said to the chef, wow, this slaw today is amazing. And he said, well, it's got all that in there. I couldn't even tell that was what was in there. I'm just saying, in this discussion that we're having, this is not only true of the cooks and the organizations that we train, but it's not anybody's go-to vegetable, and New York State is never going to be the breadbasket of tomatoes and cucumbers, so we really need to promote what we grow. And that will be a long-term process, I guess.
Greg, you guys run a culinary training program. Is that part of the process of changing our food system?
I think definitely we want to train people from the community that we serve to be able to get jobs in food service through our Culinary Pathways program, and not just jobs, any job in food service, but we want who's going to be the next change makers to our food system. It's not going to be someone, I used to work directly and help lead the Chefs Move to School program nationally, and the chefs who would be on TV who are saying to kids, you should eat, X, great marketing, but actually you need on the ground people that are reflective of your communities, right? Like someone like, oh, I know that guy, or I know that lady, she used to work down the street and now she's in my school food kitchen. Like these are the people who have the most influence on us. And so if we can help drive people to good, in a sense, good food jobs in the public sector, that is a huge change that can happen. And I want to go back to sort of this, I mentioned this question of listening, to this question of how we influence some of these pieces. And I'll give an example of where people don't listen. I was working for the City of London in the UK, and I was hired to change school food menus to be more reflective, culturally appropriate. The schools were 80 to 90% Bangladeshi immigrants. Standard 50 to 70-year-old white female British cooks in the kitchens. They wanted to learn how to make better curries. At the same time, I was doing nutrition education classes in East London. The moms, Bangladeshi moms, wanted to know how to make better shepherd's pie and fish and chips with their kids. No one was actually listening to the consumer, these kids. My wife just happened to be doing a PhD in medical anthropology and interviewed 600 young Bangladeshi girls who all they talked about was how bad their parents' British cooking was and how bad the school food curries were. And it was like, if people just did the cooking that they were good at, these kids would be happy. They wanted to have their home cultural meal with their parents at home, and they wanted to hang out with their friends, getting the equivalent of their shepherd's pie and fish and chips. But no one was listening to each other. And I think this is really important when we think about procurement. What are we buying for who? Like we listen to our customers and find out what they want. Now, our chef training program, we're trying to do more of this piece of, okay, we get a lot of in-kind donation, right? So when we get in lots of kale, a lot of our customers, it's not their first vegetable of choice. So that's an area, and different squashes. We might do a squash soup. We might do, using different breakfast grains. We want to give people opportunity to taste different products because most people don't cook that much anymore. I'm not saying immigrants are X or people who are in poverty are Y. I'm just saying, in general, humans don't cook as much anymore and they need some help because they don't know how to do it. So we've been trying to push that, and I think that's us doing marketing. It's really important to think about marketing, and I think you can trace it all the way back to groups like Bejo Seeds or Bejo Seeds, right? Like, these are groups, there's a reason there's a kale craze in America, and it's amazing seed groups from Amsterdam who push this, and they are now pushing what they call koolrabi instead of kohlrabi to try to market these new products. And that's an amazing thing, because they found that they can actually make money off produce. And I think that's an important thing to realize. Bolthouse Farms has figured out how to make money off carrots. That's great. Like, we might not like fully the product range, but that is something for us to be thinking about. Like, how do we get products to market that are actually helpful?
Lenox Hill Neighborhood House recently created a new staff position to work on policy and advocacy issues. Food is one of the areas we're interested in working in. I'm wondering if the panelists could talk about where we could make a difference with our advocacy and what are some of the issues we should be working on with limited resources have an impact on our food systems.
David, may I pose a question to Sarah on this topic?
Yes, we will take audience questions later, but if you can frame that better than I can, please do.
Sarah, I'm so grateful that you touched upon dairy alternatives and the fact that the milk industry has had a decrease in sales. I believe you mentioned about 20% over the last 20 years or so.
It's been declining, or demand has been declining over the last 20 years for fluid milk, but I don't know, I couldn't tell you exactly what the percent has been.
So what I'm seeing in the field as a nutrition consultant for Head Start sites is an increase in about that exact percentage of allergies and intolerances to dairy. And I think that's where a lot of the overlay is happening with regards to children not being able to tolerate and then a decrease in purchasing. And what I've come up against with the Child and Adult Care Food Program that funds the food and nutrition program for my Head Start sites throughout Bronx, Brooklyn, Queens, and Manhattan is that they will only reimburse dairy milk or soy milk unless the child's doctor writes a prescription for an alternative milk. And now what we know as nutritionists is that, the alternative field is growing, and I think there is an opportunity for local farmers of dairy milk to delve into the oat milk and to delve into the yellow pea milk. These dairy alternatives that are plant-based, which is, the trend that we're trying to promote, and also nutritionally equivalent to dairy milk, whereas almond milk and the alternative nut milks are not. So that's actually something that I've been connecting with several CACFP dietitians on, hoping to change policy with the allowable and reimbursable dairy milk alternatives, and in the hopes of connecting with people like you who are connected on the policy level to farmers and being able to incorporate them into the production of more alternative milks to sort of help, bridge the gap between their loss of sales in the dairy milk arena.
Yeah, dairy is an interesting policy challenge, specifically because both CACFP is a federal program and also because a lot of the dairy policy is also set at the federal level through the Farm Bill. So we have a number of initiatives at the state level around protecting our dairy producers because we're a huge dairy state. But the feds also control a lot of dairy pricing. But that's an interesting thing for us to continue talking about. And I know one of the things that we have worked with a lot with our dairy industry on is how do we help them support diversification of products to ensure that their businesses can be sustainable and can weather some of the storms that they've seen, especially over the last 5 years. And that's definitely something for us to consider talking about more.
I guess and this goes back to the question of listening, and I want to be careful about what's trendy in diets, and I understand, I make my oat milk at home every week because it's super cheap and super easy and it tastes fine. But we listen to our customers, our 22,000 customers, and we have a selection who want alternative dairy, most definitely. The vast majority of our customers, they want milk and they want fresh milk. They want fresh fluid milk. So we want to listen to the minority group to make sure we have access to those products. But at the same time, we want to make sure we support all the people who, if you look at the school lunch program, right, we have 30 million kids getting school lunch every day, a good chunk getting school breakfast, after school meals. You're talking 100 million milks a day probably getting pushed out. Probably too much. We'd love to have, 3%.
Not that much. Not that many kids a day, 3 million a day, no.
In America, get so in America, yeah, not New York, sorry.
Sorry.
Just thinking the big picture.
I'm very focused.
So just thinking the big picture of the dairy industry, I get it, we need to somewhat shrink these things, but also we have to think back to our consumers. And I think this is where we have to, when we think about policy, we go back to something like SNAP. And we say there's over 40 million people who are using SNAP as a lifeline. And we have to think about how we protect that, and also how we use their voices and their dollar power related to procurement, which we haven't figured out. We're this is a huge market that doesn't get a voice to say, how come my products don't cost X or Y?
Can I just say one quick thing? One of the most interesting things to me when I started making these transformations is that we can buy New York State products in many, many cases, including all of the grains and some of the fruits and vegetables for less than the conventional counterparts. And you should realize that. There is really no reason why these grains and vegetables shouldn't be used. Kohlrabi, unless this company makes kohlrabi really fashionable and it all of a sudden goes up in price, which it quite well may. But These are all really inexpensive, nutritious vegetables, and they're cheap. So we've been able to make these changes in our food without raising the food cost.
Can I just redirect this just to ask input as far as, I mean, I think SNAP, you're kind of advocating that there is work to be done there, and is that one of the issues you do with your clients, correct?
Yeah, I mean, it's difficult right now, right? We have 6 social service staff members who help, people coming to shop for food, but we want to get them access to benefits. So we can sign people up for SNAP. Obviously, with over 60% of our families coming from immigrant households, many mixed immigration status households, people are saying they don't want SNAP/food stamps because they are fearful. So SNAP is an important program influenced by, at present, federal immigration issues that are is a huge area that we're dealing with and trying to help support our customers get through this sort of present tragedy.
So on local and state issues, if we're not going to try and take on more than we can chew, where can we have an impact? Do you two see? Do you ever think, boy, if the food advocates would just get on this, we could really make this happen?
So, boy, do I I'll tell you why. So I remember when I'm just going to go ahead and tell my story about this. So I remember an early meeting that Lillian Barrios-Field and I had. Lillian at that time was the deputy mayor for Health and Human Services, with a group of people. Some of you might have been there. Some of you might remember the Food Systems Network. Yeah. And it was everybody who had been part of organizing a forum for all the candidates for mayor. I mean, they were doing other things too, right? But they had also come together to do this candidates forum. And then they came in with a very fine agenda for things that needed to get done. And I was acutely aware, as I often am, and again, with our listening, and who are we listening to, I think is also part of this. I was very interested. It was clear to me that some people who were in that room were not really speaking, they were speaking for people on SNAP, or they were, just sort of in a couple cases, one-man bands, on these issues. And, so one of the things I think has always been missing, or is largely missing, is there are certainly coalitions that your person can be already, your new person who may or may not be here, can be part of on SNAP, on WIC, on any number of issues. We're dealing with ABODs, but I think right now, which is the able-bodied adults without disabilities, or there's another bad rule that's in draft form. But I would also say that will jeopardize people's SNAP, but I would also say that, so join those coalitions for sure. But then the unique thing that an organization like this, which has this program, you are a settlement house, and therefore you are part of a certain cross-section of people in terms of age and class. There's just a lot going on here. And this is a community of people that eats, and this is a community of people that buys food, and this is a community of people that tries to feed their kids, hopefully. As seniors are probably among the most disenfranchised people in our food system right now for a host of reasons. It's really bad in New York. And so if you can organize those folks, or organize conversations with those folks to say, this is what's really impacting our community of participants in our programs, that would be a unique thing, believe it or not, in this conversation. That would draw attention.
I would echo that. I would say having the actual voice of people who are experiencing either food insecurity, I don't like, but having the voice of people who actually were talking about participating in the conversation, that would be a huge thing. I think policymakers should be engaging with, not engaging about. I totally 100% agree with that comment. And then from a specific policy perspective, if wishes had wings, I wish that the state could be able to set either benchmarks or requirements, or sort of wave a wand and let us allow our state agencies to procure, to mandate local procurement. I think that would be a very transformative thing, and we are prevented from doing so. So that would be my thing.
I'll just add, and obviously on the local level, your person can be involved. Like a lot of our customers, just like we're saying, like people who are part of the Silverman House, advocate with us, and we bring them down to meetings at city council with city council members, testify at the different like general welfare hearings, and speaking about how they're getting food and telling their story. And for us, that's also about advocating for changes in the word, DFAP and IFNAP, like city and state level funding that goes for emergency food, which goes back to what are the products we should be getting and where are the dollars going. So people have a unique voice to meet with their local council members and borough presidents and such.
We are about to move on to audience questions. Before we do, I'd like to very quickly ask all of our panelists to suggest one big idea, whether or not they actually have the ability to pull it off, that could help to move our food system, our public plate meals to be more healthy, equitable, and all the other things we've been discussing today. Either end, want to start?
I'll start. I have too many big ideas, but always a problem. But I think it would be really fabulous, and it made me think about it when I was looking at that great food transportation, that transformation, the food planetary health from Eat Lancet. Why can't the city of New York have an initiative that's on every bus and every subway? And I mean, they've done it with some other things, and we are a center of innovation in this country and on the globe. Why can't we lead that charge and have a great city food transformation? We know that there's going to be a further urbanization all over the planet. New York City will probably only get larger. I don't know how, because all the trains I ride can't fit any more people on them. But aside from that, we know that there's going to be an urbanization, and the fact that people don't really understand the relationship between the rural areas of the country, i.e. New York, the rest of New York State, and the city, and there's such a divide, politically and otherwise, that I think if people understood our interdependence, it would be a really good thing, and that initiative could promote that also. I also think there should be more food hubs. Yeah. Because that is of all different types.
More logistics.
Yeah, more infrastructure, more logistics.
Capacity for logistics.
I guess I would say, I've talked a little bit about collective purchasing, but I think it's not innovative, but it just doesn't happen when it should, which is collective action. And I think it somewhat has to do with consolidation. And we see it in the for-profit sector, consolidation to have better efficiency. But when we think about, for example, 900 emergency food providers who are doing a really inefficient job of getting food to people in need, especially healthy food to people where they live in their communities, I think there has to be collaboration on one level, and one other extreme is consolidation, mergers, acquisitions. Like it feels nice to have lots of little organizations, but at some point, we have a lot. It's like going to as a chef, it's like going to a bad restaurant. Like if the food is bad, I don't want to go back there. And it might sound crass of me to say that, but like we actually need good organizations doing good work, paying good wages to their staff, to give them, like we pay all of our staff a good wage, everyone's on full benefits, their entire families are, they have a retirement program. Like I want everyone who works in anti-hunger to actually not be hungry. Like, that's an absurdity. Or have to volunteer their entire life away to do this. Like, so I just think mergers and acquisitions is the way we need to be thinking about stewarding dollars in a bigger way.
A lot of the work that I've done is with faith-based organizations. African Americans are more likely than most other groups in the country to attend church, and so it's an ideal place to meet them where they are. And quite a few churches, some of the larger churches, have kitchens. Others may provide meals after special services and things like that. And I think it's an opportunity to work with those kitchens in the churches to teach those cooks how to offer fresher, healthier meals, not the fried chicken that honestly the parishioners are looking for, but and as a way to start to change some of those norms and expose people to healthier options that are tasty, they're going to enjoy and hopefully want to start to do in their own homes.
So while we're working on hubs, logistics, aggregation, all those pieces of it, I think at the local, which is very important, and may not all be done by, foodies, like, I think is the point. So it's not like we have to reduplicate those tasks, those of us who spend all of our time at panels like this, a lot of our time. I think my wish would be that, I continue to hold out hope that the federal government, I don't know why I hold out this hope, but that the federal, I don't know, let me not talk about politics, but I would say that, if there's ever an infrastructure initiative focused on cities, I would say that I would want to see kitchens built and workers skilled and paid to feed the public. And that would happen because we didn't have this explicit or implicit bias that there are some people who deserve to eat and some people who don't. Sometimes it's their fault for being, malnourished. And so, because we know that's not true. That's not what moms want to feed their kids well. Your doctor agrees with me. So that's my dream. My dream is like we have the means to do with this food that we're somehow going to get to the city that's being purchased, the means to actually prepare it, like what Lynn has. Let 1,000 Lynn's bloom. That's what I want to see.
I have two. One is very wonky, which is everyone procures food differently, and that's a nightmare to navigate. So I would like to see one common, simple platform where people could go to figure out how to procure that does all the agencies, but also nonprofits that want to leverage contracts. That they can go to one place where they can basically I don't know, to use a very technical term, although I'm not actually a tech person, sort of a skin that has all the underlying platforms underneath, but it's just one common interface that allows people to order off one place and then deals with all the back-end stuff separately. Because everyone who's doing food purchasing has a lot of work to do, they're busy, they don't have a ton of time, and it would be great if we made it easier for them. That's one thing, and I don't know if it's actually even feasible, but that's one thing. And then the other thing is, I would love to see us do more, and the city's done some really cool stuff and thinking on this. I'd love to see us do more integrated development work, where we try and put food into neighborhoods while we're thinking sort of more holistically about housing, about access to transportation, about good jobs, about the sort of gamut of things that limit people's access to fresh food, not just the food itself and not just the capacity itself, but what are all the other limitations limiting factor, so that we start to think about people as whole people rather than just as one part of those people.
All right, terrific. Do we start with Rachel?
Hi, good morning. So my question was regarding advocacy, but more on a local
Could you
level.
also tell us where you're from?
Sure.
I would love that.
Can you wait 1 second? We're going to use the mic so people can hear. Thank you.
I wasn't loud enough. Hi, good morning, everyone. I'm Rachel Ingram from Bronx Outreach. I had a question around advocacy, but more on a local level. My thoughts are, in terms of community boards, is there any power or influence around food and food systems in the community? Yeah, so that's my question. And maybe it's more directed towards Barbara.
The levers of the community board are multiple, and some community boards are more successful than other community boards. Unfortunately, the communities that need a functioning community board, highly functioning community board, are less likely to have one. So with that caveat, one of your jobs is to make them better. And I would say that, to the extent that they're involved in land use, which is not a conversation about the tool of land use, nor is it a conversation about the tool of budget. They're not involved in procurement, but they definitely are involved in land use conversations, back to what Sarah was talking about, and they're definitely, they have input into budget, although they should have more. And there were these 3 ballot initiatives, and one of them was to make the community boards a little more sturdy and powerful. So familiarize yourselves with that. Definitely make yourselves known to your community boards. If one of your issues is more retail access to healthy food, and you're interested in seeing developers partner with supermarkets and apply for Fresh or the new A-Step program, by all means, and we will make sure somebody is there to help you.
Thank you.
Hi, good morning.
It's working.
Hi. So this is a great panel. Thank you all so much. My name is Samantha Levy. I work for American Farmland Trust. We're a farmland conservation organization. I used to live in the city, but I live upstate now. I'm dealing with a lot of the political divide issues that Lynn talked about. So being folks who work very directly, some of you on procurement in New York City, talked a lot about listening to communities, and I understand the need for a strong urban focus and a lot of thinking about sort of values-based procurement. But I wonder, and Lynn, I like how you talked about sort of knitting downstate and upstate together a little bit more. I wonder sometimes, in thinking about those kinds of initiatives, if we're not listening to farmers and meeting them where they're at, and how more can be done to do that, given the state that agriculture is in right now and the challenges that they're facing, and not just in like bad markets or for dairy farmers real difficulty, but also in like transitioning to the next generation and keeping their land and land tenure. So I understand that part of this is purchasing from local farmers and supporting them, but are there ways that you think that we can better listen to farmers as people in New York City with such purchasing power?
I do just want to point out that we do not have an agriculture division within New York City. We do have something called Grow NYC. And if it didn't exist as it does today, you would have to create it. It was actually created 40 years ago as the Council on the Environment for New York City. And the board is appointed by the mayor. And all of us who are on the board, through Grow NYC is how I know farmers. And, period, paragraph, they're only the farmers who are part of the programs who are working with Grow NYC, and there are a dwindling number of them. there are always, as those of us who are part of this regional food hubs task force, which was the city-state task force, know there's more work to be done. And I'll leave it at that. Maybe there's some things.
I would say one thing I should have mentioned earlier is the state also launched an initiative several years ago, sort of a branding and marketing campaign called New York State Grown and Certified, which tries to promote New York State produce and producers who comply with sort of best-in-class environmental and growing practices, largely in compliance with some of the newer initiatives that have come out of the federal government, but that also tries to promote sort of local New York State commodities. And part of that, I think, is also introducing New York State producers to the public. I think we have a lot more work to do on that. I also think that the urban-rural divide conversation is a huge thing that we really haven't figured out. So I think that's a really good question. We'd love input on that.
Yeah, and I realize I should put this in a global context because, you know, I go to these meetings, so there's non-urban food policy pact cities that, you know, New York City, we were part of the drafting of that pact, and we were one of the first to adopt it. The second is that a lot of larger cities from that group are now part of the new food systems network. It's part of C40, which are the 40 plus now cities that are most impacted by climate change, either because they're going to dry up or they're going to flood. And so, guess which one we are. So I would say that, but seriously, you know, I would say that, you know, so in that conversation, and when I go to the, you know, meetings of people at the UN, they're very high, you know, 10,000 foot, 20,000 foot conversations about this stuff, right? But it, you know, they talk about the urban-rural nexus, and that's, you know, when I'm at these meetings, like, you know, there's Montpellier in France, and they have like a bio, you know, zone that's like 5 inches from the nearest, from the central city. You know, New York City, the metropolitan area, and our geographic proximity, and of course the shrinking of, you know, the amount of development that's going on in the Hudson Valley. I mean, I'm preaching to the choir, I know this, but some of this stuff is just like, I mean, we know that farmers are protecting our water in the watershed. We know that. And we know that they pay a price to do that, and it's hopefully it's good for everybody, hopefully it's good for them. But, you know, they're dairy farmers. They're these dairy farmers. So we know all these things, but one of the challenges that comes up in all of these meetings is we're all cities dealing with a state or territorial government of some kind, and we're dealing with federal governments. And the further up you get in that, you know, present company accepted, it's, you know, present company accepted, it's more and more conservative in how it looks at these issues. So it's a challenge because we do need so much more support. We can't do this, the farmers can't do it. Frankly, the state's not letting them down. I think the feds are letting them down, you know, and I'm not going to get on that right now, but you all know what I'm talking about.
Do we have one more question?
Hello, good morning. My name is Jennifer O'Keefe. I'm a registered dietitian with the New York State Office for the Aging at Albany. And my question is, in regards to local, how would you define that geographically?
Great question.
Great question.
This relates to what I was just talking about, yes. Go ahead.
Well, this is an area where we have everyone has a different definition. So the state, from the state's perspective, we define it as within the jurisdictional bounds of the state. The feds define it as essentially however the jurisdiction of jurisdiction defines it. So we in the state have something called home rule, which means that the jurisdiction, the lowest possible level of administrative unit determines the governance. So that could be anything from your county to your city to your special fire district. There's all sort of, we have more levels of administrative unit than any other state in the country. Some of them have the steps defined.
Stay in New York City.
So for the state's perspective, let's do this. The state's perspective is within the state, and the city is.
You know we're friends, right?
Yeah, we're within.
Just say. Of what?
New York City?
No, I'm saying for New York City,
Yes.
what would the state say
Oh,
us about what local beach?
within New York City.
That's right. That's the answer.
Clearly, we here think of it as anything from Maine to Maryland, and Pennsylvania to Long Island, and New Jersey, and I mean, essentially what we're not thinking of it is Mexico, Texas, California, not because we have anything against them, but because we would rather be getting things, let's call it a 250 or even 500 mile radius. The closer you can be, the better it is. The more you can know who you're buying it from, the better it is. The closer geographically you are, the more likelihood it is that you'll know where it's coming, that you know who it is that's growing it and how they're growing it.
I guess I would just add from an emergency feeding perspective, like in our state grants, we have a certain percent has to be bought as it's New York State. So that's what we go by. We're trying to get, for example, dairy. So it might be the dairy is further away in New York State than milk in New Jersey, but our grants are from the state. That's what it is.
All right, thank you, panelists. That was